Welcome to day 2 of the 2025 National Conference. I hope you enjoyed your breakfast this morning. It was sponsored by Brain Lab and Piedmont Healthcare, so thank you to them for sponsoring our great breakfast. Additionally, I hope you got a chance to get some rest and relax and recharge. I know my head hit the pillow last night and I did not wake up until the alarm went off this morning. So it was truly a special day yesterday. It was wonderful to see everyone networking with each other between sessions and at the cocktail reception. You know, building community is one of the ways that we think helps to manage a brain tumor diagnosis and the challenges that people face when they are diagnosed with a brain tumor. If you haven't done so, please make sure that you're introducing yourself to the people that you're sitting with at the table. Exchange contact information and get to know each other, because it is a great way to support each other during this time. It is now my pleasure to introduce the American Brain Tumor Association's first executive directors and honorary board members, Don and Gail Segal, who will be presenting the recipient of ABTA's highest honor, the Joel A. Gingras Jr. Award, also known as the JAG Award. And I just want to give a shout out to the Gingras family, to Jonathan, Sandra, and the rest of the family who are watching with us virtually. They could not be here today. So Don and Gail, come on up.
Thank you, Kelly. I'm so pleased and proud to be here and to take part in this session and to spend just a couple of minutes talking about the Gingras family and the Gingras Foundation. I've had the privilege over the years to attend several of their events in the Philadelphia area, and they are an amazing and awesome group, to say the least. The Joel A. Gingras Foundation has been a longtime partner of ABTA. When Joel died from a brain tumor in 1988, the Gingras family decided to dedicate their lives towards helping others fight the disease, and they formed the Joel A. Gingras Jr. Foundation and have been doing that over all these years, and have been doing it on steroids. If you ever get a chance to meet any of the Gingrases, you'll know exactly what I'm talking about. Since partnering with ABTA in 1995, the JAG Fund has donated $3 million to ABTA research, funding 33 medical fellowships, 5 discovery grants, and 1 research collaboration grant in Joel's name. These funds have drastically impacted the way that ABTA serves the brain tumor community. We thank them for their tireless commitment and partnership. In recognition of the Gingras' dedication to the cause, the ABTA proudly established the Joel A. Gingras Jr. Award in 2010. The purpose of the award is to recognize an individual or an organization who, through philanthropy, advocacy, discovery, or patient care and support, have had a transformative impact on ABTA's mission advancement. Gail and I, were honored to receive this award 2 years ago and are grateful to have the opportunity to pass it on to this year's recipient, Dr. Erin Dunbar. Gail?
Dr. Dunbar is the founding physician and director of Neuro-Oncology of the Piedmont Brain Tumor Center at Piedmont Atlanta Hospital. From pioneering multi-center clinical trials to delivering life-altering diagnoses, Dr. Dunbar meets each moment with clarity, compassion, and purpose. Her work is rooted in personalized medicine, equity in access to care, and what she calls evidence-based hope. the powerful combination of science, strategy, and human connection. Whether she's collaborating with the National Institutes of Health, NIH, mentoring the next generation of neuro-oncologists, or working with policy and insurance leaders to expand care access, Dr. Dunbar is driven by one goal: making sure that every patient everywhere has the tools and support to navigate their journey. Dr. Dunbar's career has been defined by service to patients, to science, and to a future she's helping shape every day. The ABTA is honored to recognize Dr. Erin Dunbar for her visionary leadership, trailblazing impact on brain tumor research and policy, and steadfast dedication to delivering compassionate, patient-centered care that continues to inspire hope and progress across the brain tumor community. Please help me congratulate Dr. Dunbar.
You get away. Okay. Because you have to take a picture eventually.
I'm supposed to hand this to you, but it's very heavy.
It's very heavy, so we're going to wait.
Thank you so much for this lifetime honor. Thank you so much.
I
our
get one
pleasure.
of those too, right?
Absolutely. Thank you so much. Do we stand for a picture? Should we do a picture now?
You want to do the picture, or you want to say a few words first?
I'd love to say a few words.
Okay, you say a few words first.
Can you hear me in the back? Well, early on in my life, I decided that I wanted to be in a helping profession, but I had no idea where that journey would take me. I'm really deeply privileged to be here today. So I want to thank some people on my journey. First, I'd like to thank my parents for giving me roots and wings. They instilled fascination in me for the keys and locks of medicine and the scientific discovery and a trailblazing, pioneering heart. I want to thank my siblings and my family. So I come from a very big family who also gave me unconditional love and support, humor, distraction, and interestingly, our idea exchange between our different walks of life really helped to instill new ideas that I was able to put into the medical profession. I'd like to thank my incredible medical work family, especially my wonderful team here today. Thank you all. So we spend more time together than we do our own families. We work, pray, laugh, cry, and heal together. It is such a privilege to work alongside them. Every day they recommit to walking the journey with our patients, caregivers, and our healthcare team, knowing that not only will it be tender, but it'll also be transitional and tough at times. I'd like to thank my absolutely phenomenal husband. So the Superman quote, remember Lois Lane, and she's, gets caught by Superman, and she says, well, you've got me, who's got you? Well, he does. Another quote that makes me think about my husband is when COVID hit and they talked about medical workers and essential workers. Well, he's an essential healthcare worker as well, and he's my healthcare hero. Truly, he is in spirit with me in every patient encounter, every board meeting, every podium, and every medical event. He bears the burden of my hardships and also helps give me solace and inspiration. He provides me with unwavering love and support. He's truly the greatest thing that ever happened to me and really my tangible proof of a benevolent God. So I actually have an ask for everyone here. I want to ask you to do this, and I want to ask you to pass this idea on. Include your thanks to medical team families and loved ones when you're writing your patient satisfaction and when you're writing your thank you letter to your doctor, your nurse practitioner, PA. Thank their families as well and encourage them to share it back with their families, because it's our families who really encourage us, sustain us, and fulfill us. Include them in your prayers as well. So now the ABTA. Difficult to encapsulate what they mean for me. Truly, each of them are earth angels. They graciously welcomed me into their medical home over 15 years ago. They gave me a medical family. What they do for all of us is the same. They create a medical home for life for patients, caregivers, and increasingly medical teams. They consider all of us friends or friends they haven't met yet. They gave me agency. They honored me by listening to my ideas, implementing many of them, and it's been phenomenal to see them in action. They gave me security across a medical profession that is inherently fraught with transitions in healthcare and turmoil. They gave me tremendous professional and personal reward. They are best in class in education, resources, and support. One of the things that I'm so grateful for is how they so freely give of education handouts without requesting money or resources in return. In particular, their ability to archive information that becomes a treasure trove of resources for all of us when we need it at the time we need that help. Having virtual live stream meetings, webinars, conferences lowers the barriers for people who have transportation or other obligations. They can't do that activity right then and there. And they allow us to tap into all of this information all the time. They advocate for us in countless arenas that you may not even know, with legislators and payers, insurers, leaders. Every time they can, they're looking for creative new ways to help patients, caregivers, and medical teams. They provide countless scholarships, grants, and they really ease the burden and improve the journey for all of us. Their gathering and fellowship events and their ability to help us network and facilitate, like the communities we're building today and that will carry on before, truly creates a medical home for all of us. Thank you so much. Thank you so much. Thank you.
You
Want to hold up the...
remember how heavy it is, right? Okay.
Erin's strong. She's got it. Do we need to move over a little bit? Do we need to move over a little bit, or are we good? Yeah.
Thank you so much. Thank you.
Yeah, we'll take it.
Well, we hope that you guys had a wonderful day yesterday. I think when you think about all of the sessions, starting with the brain tumor board, following with managing scanxiety, talking about research within the ABTA, and hearing about palliative care, breaking down some of our perceptions about what that means and how that can actually improve quality of life, and then to follow that up with such an inspiring keynote speaker, I think we could feel the energy in the room before the night was over. And then we're really appreciative of you guys walking over to the poster session, mingling with the next generation of brain tumor warriors. And I think we have a wonderful session for today as well. I'm going to let Dr. Logan give some remarks as well, but we're really glad that you're all here, and hopefully you'll get that sense of community by the time you leave. I think you already have had that, but we're really excited to share this day with you.
Thank you. I wanted to share a conversation that I had last night. So we all had a long day. It was an exciting day, and I went back up to my hotel room and called my husband. And the first thing he asked was, how was it? Like, how was the day? And I just told him, I was like, it was amazing. And I started to cry. And I said, what I witnessed yesterday was community. I said, we learned together. We were empowered together, we laughed together, we cried together, and then at the end of the day, we danced together. I want to remind you that this community is special. And when I come to the ABTA and I come to these conferences, I am reminded of exactly why we as clinicians do what we do. And Dr. Dunbar just spoke it so eloquently. The excitement and the strength and the hope and the passion that you all bring to us is why we go back into that clinic day after day and learn new techniques and bring new treatments and new strategies to help improve your quality of life. I'm so happy how yesterday went. I think today is going to be equally as exciting. We have science, we have clinical trials, immunotherapy, and of course adding in that quality of life and discussing some hard topics like grief and change through the diagnosis. I welcome you to continue to connect, as you have heard already. I challenge you to meet somebody you haven't met yet yesterday and make a new friend today, and come and chat with us anytime. We're excited about the day.